I thought we'd start maybe with a little overview in terms of what is lupus, and maybe the rheumatologist could kind of try to define
that. You know, systemic autoimmune diseases is a big part of rheumatology. I mean, yeah, we see some degenerative diseases, but this is sort of what defines us. And lupus is one of the most common systemic autoimmune diseases. So what do we mean by systemic and autoimmune? You know, systemic, it pertains to different organ systems. So it's a very good example, since every organ system can be involved. It can involve the skin, the joints, the heart, the lungs, the kidneys. So all the organ systems can be involved. And autoimmune, you know, our immune system, its main job is to protect us from foreign invaders, bacteria, viruses, fungi, and to also separate things that are not part of us, that are not exactly infections. For example, we could make cells that don't quite look right. They're not quite cancerous, but they don't look right, so your immune system can help delete those and protect you from getting a tumor. And even when you do have cancers, the immune system helps you delete, get rid of these, and helps you fight them. And in autoimmune diseases, you lose some of that. You lose some of the ability to recognize what is self and what is not self. And so to protect you, these immune cells are doing what they think is their job, but you actually get inflammation and injury to these organ systems, your skin, your joints, your heart, your lungs, your kidneys. So I kind of think of lupus as the best example of a systemic autoimmune disease where chronic inflammation can lead to permanent organ damages. So when we see patients, we actually try to go through every organ system. We ask, you know, chest pain, shortness of breath, what rashes do you have, sores in your mouth, is your hair falling out, do you have any painful joints, are your legs swelling up, is your blood pressure going high, you know, all these things that pertain to these different organ systems. And we use all of these to say if there's, you know, disease activity and what we need to do about it to fight it. So in the end, like I said, this is probably one of the best examples of systemic autoimmune disease to a rheumatologist.
Yeah, I think that's well said. I mean, I think it's, you know, the problem is we still don't really understand what causes lupus. You know, it's some problem with an interaction of our genetic makeup and what drives the immune system, and what creates that alteration of an abnormal immune response within the body that creates a variety of diseases. And so one day we'll figure out what's causing this, in addition to arthritis and all the other diseases that are classified as rheumatological diseases. And then once we figure that out, it's going to be a lot easier to actually get a more defined, better treatment than what we've got right now.
I had a question. I missed the first part of it for Dr. Bryan, and coming from that family physician side. So how do you guys go about understanding when you need to test for lupus to say this is what it's, because it can take, what, 5 to 7 years to do this. So what are you doing to change it?
Sure. Well, part of it is asking the right questions. And I think in order to ask the right questions, you have to have knowledge of what you're looking for, right? So if you don't have any understanding of something, you're not going to ask the questions. You're not going to dig deeper. So part of it is having that recognition, right? So, and then it's so much, the presentation is so varied. I can honestly say I don't think I've ever, I know I've never slam dunk been like, first visit, that's it. But as you start asking the important questions, as you get the family history, as you tease down, you know, when it just doesn't make sense, when you cannot link X to Y to Z, that's when you have to start thinking out of the box. So I would say, as far as like how do you know when to test, part of that is just your level of suspicion, and I think having the, or taking the time, I would say, to ask the questions that you know, kind of are the outliers. Well, you know, that general, like, I don't feel right and I'm relatively healthy otherwise, you know, that kind of patient makes you just sit down and kind of go, okay, well, let's do a system by system kind of discussion here. And it's difficult, right, because it may not be every system lighting up on the, 12, 4 out of the 11 guidelines, positive and all of that. So I would say having just, that level of suspicion. And it usually takes seeing someone, potentially trying to treat the symptom they present with, and let's say that symptom gets better, but you're following them back. And that's my main thing, is I don't let people go and say, well, just come back if, things don't get better. You set that follow-up in a reasonable time, and then you're checking back in, and when you check back in, oh, great, your, shoulder pain is better, but now I'm having, I have a sore in my mouth. What's going on with that? And then it's just knowing that you need to link those things together. And I would say definitely in primary care, using your resources. I'm never managing lupus patients on my own. I'm getting input, whether it's from my colleagues, whether it's from specialists that I have relationships with in the community, and say, hey, do you think it makes sense that I should screen this person? Because we all know that there are false positives in screening that cause a lot of distress and angst, and the last thing we want to do as physicians is we do no harm, right? So it's a long-winded way to say you have to trust your gut and follow things closely. You follow the clinical picture, right? Not just the lab work.
As a dentist, dry mouth, we observe it first before a doctor would. So I think as part of the public, like us, for example, I think we need to be a little bit more involved in our health. I mean, we have Google now. It's only a finger away. I mean, we have Alexa. I mean, all this. I mean, we are so lucky nowadays compared to years ago. So let this technology help us a little bit, so we can raise the questions to our doctors, because they are busy as well. As she said, if we don't ask the right questions, right? That's the first step.